Hello everyone and welcome back to another insightful episode of Synapse podcast series. I'm your host Hetvi and today we are focusing on early identifications of developmental delays in pediatric patients, a topic that highlights how timely recognition and intervention can significantly influence a child's long-term growth, learning and entire quality of life. And to guide us through this important topic, we have with us Dr. Anuja Pakhare, a consultant pediatrician, neonatologist, and family physician with over 15 years of experience in child healthcare. Doctor has extensive expertise in newborn care, developmental assessments, and preventive pediatrics, which makes her the perfect guest for this discussion today. Doctor, welcome to the show, and it is such a pleasure to have you for this discussion today.
Yeah, thank you for having me here. Thank you for having this opportunity actually.
So doctor, to begin with, can you tell us what exactly developmental delay in children is and how is it different from variations from normal child development?
Okay, so developmental delay. Development is basically a series of events that the child goes through, okay, from the time of birth and even before that actually. Okay, developmental delay is a consistently lack in achieving milestones that are appropriate for that age. Okay, so if there is a consistent lag in that sequence of events which should occur, okay, that's when developmental delay comes in question, and we want to evaluate that thoroughly because there are certain developmental conditions which can improve with early intervention. So from normal variation, if you see, there is always a range of a few months where that particular developmental milestone can occur. But some children, they catch up on their own without any clinical intervention. But some of them, they may progress slowly to attain milestones, and they are the ones who require help and early intervention.
So it's like understanding what exactly the changes are in the first lines.
Yes.
So, Doctor, could you tell me what is the prevalence of developmental delays today in children?
So as per some recent studies conducted in our country, in India, recent studies show that the developmental delay prevalence in the community is 2 to 7%. Okay, so that's quite a large number, and that needs to be addressed so that these children also develop to the maximum of their potential and their quality of lives are better in future.
Yeah, that's like a significant number though. So now Doctor, additionally to these factors, what antenatal factors also influence the developmental and neurodevelopmental delays in children?
Okay, so there are various antenatal factors, okay, because the growth of the baby starts once the baby is formed in the mother's womb, okay. So maternal nutrition status is important. Mother, if she has any psychological illnesses or medical illnesses requiring certain medications, sometimes some of the medications can have an adverse effect on the baby and growth of the baby. Sometimes if the mother consumes smoke, is a smoker, consumes alcohol or consumes drugs, that can have an adverse effect on the baby. Also, there are many studies that have shown that dental health is important in mothers. Chronic inflammation of the gums, which is gingivitis, is shown to have a larger incidence of having preterm labor and preterm birth, premature birth. Also, it is linked to having low birth weight babies. That means it affects the baby's growth in the womb, that the baby cannot grow to his or her full potential. Okay. So these are some of the antenatal factors. Of course, also the psychological health of the mother is important. Okay, even gestational diabetes is linked to certain neurodevelopmental conditions. Other factors include placental blood supply to the baby and overall health during the pregnancy period, which will of course be monitored by the obstetrician in charge. But these are some of the things we need to actively look for because these are preventable or treatable at least. So that is why it is important to watch for these things during the antenatal period.
So it's like a lot of different factors influence the growth of
Yes.
the baby antenatally.
Yes.
Thank you for sharing.
Yeah.
So now, doctor, coming to that only, what are the key milestones that actually pediatricians should closely monitor?
So the milestones that we keep a track of, or I would rather say that what we look for or have a watch on is, are there any red flags? Okay. So mainly what we look for is, at a certain age, though that particular milestone is a must, and if it is not there, then we need to evaluate. Like at the age of 3 months, first of all, when the baby is born itself, at that time itself, the attending pediatrician looks at the developmental milestones that are supposed to be there at that age. Like for a newborn baby, we look for sucking reflex, rooting reflex, moro reflex. Okay, we look for the tone of the baby. Okay, and of course we examine the baby thoroughly. At the age of 3 months, we expect that the baby should have attained head control, the baby should have social smile, good eye contact. Okay, cooing sounds should be there. So these are the things that a 3-month-old baby should be able to do, right? At the age of 6 months, we expect the baby to roll over, to have at least bidextrous grasp, reaching out to objects. The baby may start babbling. Those are all the expected things at the age of 6 months, sitting with support. Okay, at the age of 9 months, we expect the baby to sit without support. Okay, the baby should start babbling at least bisyllables. Okay, and also stranger anxiety. Okay, the baby knows who are their own family members and who are strangers. Okay, and by the time they are 1 year old, they should be able to crawl, they should be able to stand with support at least, and they should be able to take the first few steps. Okay, and also indicate their needs through some gestures. That is expected at 1 year of age. So these are the things we look for grossly. Of course, there is a more detailed evaluation to it, but whenever a child comes to the clinic or to the OPD for a consultation, irrespective of what their other primary problem is, we basically look for these things, so that if we find any red flags, we can refer them to a developmental pediatrician on time, where they can be assessed for these things. After the age of 1, in the toddler age group, like 1 to 3 years of age, if a child is not able to have few words of vocabulary by the age of 18 months, if they are not able to walk independently by the age of 18 months, okay, that is when we need evaluation for sure. Okay, by the time they are 3 years old, they should be able to communicate in few small sentences. They should be able to follow simple instructions. Okay, able to tell stories. These are the milestones we look for when it comes to language and social development. They should be willing to share their toys, or communicate and play with other children. And in the preschool years, which is 3 to 5 years of age, that's when we want the child, of course, to be able to communicate and all. And also we look for all the other milestones, gross motor milestones, fine motor milestones. So there is a huge list of those things which we evaluate in detail at the time of clinical visit. And however, at any age, if we find that there is poor eye contact or poor social skills, like child is not mixing up with other peers or with family members, or if there's poor eye contact, at any point if we find that child needs evaluation. Even if there's regression of milestones, like earlier the child had attained that milestone, but now the child is regressing, like losing those milestones, that also requires evaluation. And certain sensory issues, where if the child is overreactive or hypersensitive to some particular sensory stimulation, like for example certain textures of food or clothes, okay, or other sensory issues like auditory issues and all. So those are the things which we look for. Okay, and these are all the red flags, and we have to thoroughly work up these children for their whether they are going to develop normally or not, and we have to find out the underlying etiology, underlying cause, so that we can do all the early intervention, okay, and go through a multidisciplinary approach where we involve all the other specialties like occupational therapy, physiotherapy in certain cases is required, speech therapy may be required, auditory, that is hearing tests may be required, vision tests may be required. So these are all done looking at the child by giving them holistic care. Basically, a holistic approach is required.
All like these checkpoints start from day one, and then all of it comes down to intervention.
Yes. Yes.
Thank you for sharing that, doctor. Now, doctor, many children today especially require specialized neonatal care. So, how do factors such as prematurity, low birth weight, NICU stays, or birth complications influence long-term neurodevelopment outcomes?
Okay, so first of all, the growth of the baby starts when the baby is inside the mother's womb. Okay, that is when it all starts. So there are certain antenatal factors, that means factors before the pregnancy, as in the delivery. Those are the antenatal factors: the maternal nutrition condition, the maternal consumption of smoking, alcohol, or other drugs. Also the other factors, like there are certain genetic factors which come into play. Then there are some other factors during the pregnancy, like the placental blood supply to the baby, okay, and other factors that can hamper the growth of the baby. Okay, even vitamin B12 and folic acid deficiencies in the mother can actually cause neurodevelopmental issues in the baby later on. Gestational diabetes also again is linked to some neurodevelopmental disorders. So the antenatal health of the mother is very important. Okay, once the baby is born, nowadays we see that a lot of babies are born premature as well. Okay, that was there before also, but what we see now is that care is improved. So premature babies particularly, they have missed a certain amount of period, right, which they were supposed to be in the womb. When a baby is inside the womb of the mother, the baby is supposed to be there for 9 months. But if a baby is born before that, they miss some part of that third trimester, and then they are born. So they are born with certain lag, which we are expecting that they will catch up. However, in the newborn period, if the baby is admitted to NICU, in the neonatal ICU, especially because if there is severe infection or meningitis, which is a form of brain infection, okay, or if the baby did not cry at birth, baby's got ischemia. Ischemia is poor oxygen supply to that brain tissue, okay, immediately after birth. So what happens in this kind of scenario? These babies will require NICU care, and quite often than not, they actually have certain sequelae even after discharge from the NICU. And for the first 2 years, catch-up growth is what happens, and that's why for all premature babies, first 2 years of life, they should be on regular follow-up with their pediatrician, so that their development, their growth, nutrition, these things can be tracked, and all the issues can be addressed, and we can work on that. Okay, and prematurity, low birth weight, yes, these definitely affect neurodevelopmental outcomes sometimes not individually. Like just low birth weight doesn't really mean that baby will have developmental delay, but yes, it can contribute to the other, like along with other factors. Like for example, if the baby is neglected, nutrition is not given appropriately, or emotional support, psychological support is not given to the baby, that also affects the child's brain and growth and development in general.
Yeah, thank you for sharing that.
Yeah.
It was like very realistic and practical takeaways.
Yeah.
So now, doctor, finally, in your experience, what is the biggest mistake healthcare professionals actually make when it comes to developmental delays?
Okay, so I would not call it a mistake as such. I would say clinical judgment. Okay, so everybody who comes in contact with a child, any healthcare professional, okay, they may be nurses, technicians, they may be doctors from other streams, not pediatrics, definitely. So everybody, if we look for the red flag signs, and sometimes it happens even in our family members, if there are kids in extended family, right? So appropriate referral on time, because the time that we lose is not going to come back, right? So, and the brain also gives us that leverage of neuroplasticity till the age of about 6 years. So that period is very important so that we can act on time. Okay, so clinical judgment, I would say, for any pediatrician and also non-pediatric doctors, if we notice any of these red flag signs, the first thing we should do is refer them appropriately to a developmental pediatrician. The rest will be taken care by them. okay, but we have to refer them to a proper team who will evaluate them for the developmental delay that is happening and treat them appropriately by looking for the specific cause and by providing early intervention and care, which will help in their overall growth and achieving the developmental milestones and making their quality of life better.
So it's like timely and early.
Yes, so the take home message is timely and early intervention, timely referral is most important, okay, in and counseling the parents, making them understand why it is important for their child is very important. Quite often parents are discouraged or in a dilemma whether to go for further treatment, but it is up to us to convince them so that the child does not suffer. The child gets timely treatment and gets the best out of what can be done.
Definitely, I definitely agree. I think communication is.
Yes.
Yes. So, Doctor, as we wrap up today's session, thank you so much for sharing your insights and actually giving us those practical takeaways for developmental delays, Doctor.
Yeah, thank you.
And thank you to our viewers for joining on this episode. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on the Medicine Apps platform. Medicine Apps platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, keep learning and keep evolving in the field of healthcare. Thank you.